We're going to look at releasing the glute muscles now. Now, those glute muscles are big, and if they are very tight, what we're going to end up with is not a very well functioning hip. And for somebody who has osteoporosis or anything like that, and just older tissue, we really need to wake that area up. Now, I'm going to give Mariela these balls. So we're going into the back of the hip socket. So that's basically, if you think about where the greater trochanter is, if you come up and back a little, there's a hollow back there, and that's where those balls are going to sit. So it's much wider and lower than you think. Now, we don't want to have excessive rotation in the spine here, but we do want to put a little bit more weight onto whichever side we're releasing. So we're just going to do a mini knee sway over to the side, and we're going to start off with little wiggles, just to sort of start trying to open up that space, start trying to release the tension between all those muscle layers. So we do that for about 20 seconds. Then we're going to invite that leg to open towards the floor and pull it back in. So we can do any number here. I don't really like to talk about numbers necessarily, but that's how we can sort of guide our clients, because we certainly wouldn't want to be doing 600 over here, and we also wouldn't want to be just doing 3. So maybe we'll be doing 5 or 8 or 10 of these. Then we're going to leave the leg out there, and Maria's going to slide her leg long and then pull it back up again. So now we're just introducing another movement pattern here, and we're just getting the muscles to lengthen and contract. Lovely. And then the leg's going to come up. We can take the balls out and do some benchmarking, and just to see the difference from one side to the other. And then we would come over to the other side and do the same thing, 20 seconds of wiggling, and then just gently opening and closing for anything from 5 to 10, and then sliding the leg out and pulling it up. So just depending on what your client really feels is appropriate for them. And then we'll just come back, take those wee balls out, and then we should have a nice, delicious, lengthened and weighted pelvis. Yeah.